today I have Clay Horton with the Green River District Health Department and Dr. Francis DuFrayne with Owensboro Health. They are the experts. They can answer a lot of the questions that you might have. If they don't have the answer, they're going to say, we don't have the answer. And hopefully they're going to be able to help debunk some of the craziness that's being spread out there. I continue to see it. As a matter of fact, you'll probably see some of that craziness talked about right here on this very program. I'm going to take my mask off. I'm in my office. Dr. DuFrayne and Clay, I was hoping back a couple months ago that I would never have to see one of these things again.
Well, I think we've lost the judge, so we'll hang until Jordan gets us straightened out.
Yeah, we apparently have lost him. Hopefully he'll rejoin us here. Maybe Clay, if you just want to start with a little update, I'll pull up a graphic that just highlights a couple of recent stats from the report that came out on Tuesday, I guess. And then you all can just kind of talk about the current climate, and then hopefully the judge will rejoin us here in just a minute.
Sure. So, I mean, we are seeing kind of the highest numbers of COVID-19 in our communities since the pandemic began. I think any of us that have been watching this very closely saw this coming. But you know, the report that we put out on Tuesday, we had 380 new cases for Daviess County. You know, we are seeing our vaccination rates come up across the county, and we've seen an increase of about 10% since June, which is progress. That's what we need to see, because really the exit ramp for this issue and for this problem is getting as many people vaccinated as possible. You know, I feel like that I've been asked over and over and over, you know, questions about COVID-19. It feels like it's the same story a different week in many ways. You know, there are no secret answers here. The things that we keep talking about is, you know, people need to get vaccinated. That's the number one thing that they can do to protect themselves. The number two is right now, with the incident rate as being as high as it is in the community, with things, you know, there's a lot of transmission, there's a lot of risk, and people need to be cognizant of that. So even if you're vaccinated, you need to be careful when you're around other people in public. You need to wear a mask. Masks are an effective way to reduce the spread of COVID-19. And it looks like Judge Mattingly has reconnected. So I will turn this back over to you, sir.
Hey, thank you, guys. I'm sorry. I think that when I started talking about COVID and all those crazy things that were being passed around, somebody used the internet or the waves coming from 5G to activate the nanoparticles that are in my body as a result of that vaccine. If you guys will look, and I think probably what you're talking about, Clay, is up on the screen right now. It's showing Daviess County specifically, and the number of cases that we've had, the incident rate, the number of deaths, hospitalization. Up in the upper right-hand corner is the percent vaccinated. 1% of our population has been vaccinated. One of the things I dislike about that, and Clay, I don't know how you do it, children 12 years and up are eligible to be vaccinated. That leaves our look at 51%. I think the more telling vaccination statistic is I think 63% of those who are 18 and above have been vaccinated, and over 85% of our plus 65 population have been vaccinated. Let's go to the next one, if you would, Jordan. This is a slide that Dr. DuFrayne has started putting up every day, and I think Dr. DuFrayne, we can find that on your website or Facebook page of the hospital. I know I get it every day. Why don't you kind of go through this while we have it up and talk to us a little bit about it and tell us what it's showing?
Okay, so the first thing we did several weeks ago is we started publishing daily our COVID information, so that all of our team members actually know every day what's going on. But we've also been sending it to you, Judge Mattingly, to Mayor Tom Watson, to the chamber. We're sending it to as many places as we can, because it's when you start seeing the numbers that it really starts to sink in that, oh, this is real. So we came up with this graph because it's a really easy way to really determine what's in the hospital. So as you can see in the center of the big box, this was from, I guess, 2 days ago, 54 patients were in the hospital. And then we put down who were vaccinated and who were unvaccinated. So as you can see, the vast majority of people are unvaccinated. For us, it averages about 80%. The number of patients who are in critical care. So on that day, it was 19. Again, the vast majority are unvaccinated. So once you start getting to the critical care, you're really talking about 95% of people are unvaccinated. And then intubated, again, that number is even more graphic. So of the 12 people in the unit who were intubated, who had COVID, only one of those people happened to be vaccinated. So
where can folks go to find this?
Oh, so if you just go to Owensboro Health, and I think it's Owensboro Health /link, and then you'll find all the COVID information on that page.
I don't believe we put this up every day, Jordan. Shake your hand. No, if we don't, but
Okay.
we put it up every so often, and
Right.
certainly I look at it every day because I think it's a very good illustration of why you should get vaccinated. And while I've got this slide up, Dr. DuFrayne, I keep hearing there's one rumor that goes around and it talks about that vaccinated people are the ones who are spreading the disease and then they die. What do you have to say to that?
So I've been hearing that myself, and my first thought, I really can't say out loud.
Yes.
But that is not true at all. So first of all, vaccinated or not, you can still acquire the COVID infection. And we're not saying vaccination protects you from that. And that's why you keep hearing things about even vaccinated people who are indoors in public places should have masks on. You can still acquire the infection. If you get it, your numbers decrease by 80%. So if you're vaccinated, you are much better protected from serious symptoms, what we call morbidity and mortality. So your mortality rate improves by 95%. So yes, you can have the infection. Yes, you can even spread it. That's why we still need to follow the things we've been saying for, I don't know, the last 20 months. Face masks, social distance, hand washing, get vaccinated. The vaccinated people are not the ones who are spreading it as much as the unvaccinated.
I would think too, there's a statistic that I read somewhere that 95% of the folks, doctors, have taken the vaccine. And if the vaccinated people were dying, that means that 95% of our doctors would be dying and we would be self-treating, which I think is happening with some people who don't believe this is as serious as it is. So thank you for the chart. And I guess the last thing I would say, the way I look at it is when you're vaccinated, your body is prepared to ward off that infection and gets a head start. It gets a jump on warding off. When you're unvaccinated, your body has a natural immune system, but it takes a while for it to ramp up. And while it's ramping up, those viruses are co-opting the cells in your body and reproducing, and your body sometimes just can't ward that off. Next slide, Jordan. This slide shows the current incident rate in Kentucky at 89.02. If you look, Daviess County is at 77.5. For that, I'm thankful. You'll also see that with the exception of 2 counties, Woodford and Carlisle, that we're all in the red, meaning that we have an average of 25 cases per 100,000 on a daily average. I have seen these two counties just popped up within the last few days. One of the things I want you to kind of look around, if you went on Kentucky COVID KY COVID-19 at kentucky.gov, and looked and compared the counties who have high incidence of COVID to the county's vaccination rate, you're going to find that one of the reasons Daviess County is where it's at and Hancock County is where it's at is that we have the highest vaccination rates in the Green River district. And I think you can find that pretty much the same across. So this was as of yesterday. Bring up the next one, Jordan. This is the incident rate on June the 24th of this year. If you look at Daviess County, 1.7 cases on average per day. You can see how we've grown. And if you look at some of the other counties, Henderson was 3.2. I mean, they are over 100. Union County was at 0. They're well over 100. Hancock County was at 0. Brackenridge County at 0. Hancock County is near what Daviess County is, and Brack is well over 100. It just shows you what we have done. So that's July and August in 2 months. You can see how COVID has weaseled its way back into our daily lives. Next slide. And here you are. This is a slide on the 23rd of January. And if you'll look, you'll see, I think I'm blocked a little bit on that eastern end, but there are 3 or 4 counties that are in orange. The rest of the counties are in red. And take a look at Daviess County, 77 cases per day is what we were averaging back then. It's the same as we are today. So we are back where we were back during the height of the pandemic. Next slide. So if you go on vaccines.gov, or you can go on Kentucky COVID-19.ky.gov, up in the upper left-hand corner, you will see on the banner, you'll see available vaccines, and it will show you all the things that you can see here. Clay, I'm pretty sure you ought to call ahead of time, but a lot of these places you can probably walk in and get a vaccine, unlike back in the spring when we were having to make appointments because there was a shortage. Go ahead and answer it.
Yeah, that's true. So I think a lot of them will take walk-ins now. We at the health department are still like scheduling clinics, but you don't have to pre-register or anything like that. You just, once you see a clinic scheduled, you can come in. If something's not scheduled, you can certainly call. Hospital does their online scheduling, and probably a lot of the pharmacies are will take appointments as well.
Trying to make it as easy and simple to get a vaccine for anyone who so chooses. Next slide, Jordan. And again, if you need transportation, call the Audubon Area Community Services. They will give them 24 hours notice. They'll pick you up, take you to get your vaccination. They'll wait for you to turn around and bring you back home. About as simple as you can do. Doesn't cost anything to get a vaccination. I know that some people, Clay, and let me go back to you, some people said, well, if it doesn't cost anything, why are they asking for my insurance card?
So insurance will pay us an administration fee. We don't bill insurance for the cost of the vaccine. But if you don't have insurance, there's other avenues for us to get reimbursed for that. So if you don't have insurance, that shouldn't deter you from coming. If you are going to come, we just kindly ask that you bring your insurance card. If you don't, you won't be turned away. And
I think some form of ID.
Yes, we want to do that so that we have get the vaccination record. But again, if that's a hardship for someone, we'll figure out a solution to it.
All right. Well, now we're going to get into some of the questions that were sent to us previous to this meeting. And folks, again, if you have any comments or questions, preferably questions, just type them in, send them to us, and we will get them to Clay or Dr. DuFrayne. The first one, it says, this week, the health department reported the highest number of confirmed cases for the 7-county region. And again, I think, Clay, that's what you were doing. You were addressing the current situation with a high rate of transmission. And specifically, everybody has the Delta variant on their brain now. I mean, everywhere I go, it's the Delta this and the Delta that. Tell us a little bit about why are we talking about the Delta variant today when we were talking about the original strain back in late last year and early this year?
Well, I mean, the virus naturally mutates, and as it mutates, this is basic biology, basic evolution here. The survival of the fittest, and Delta is a highly contagious variant. It emerged. We were starting to hear about it back in the spring, and it quickly took over and became the dominant variant. So pretty much all of our infections that we're seeing in our community now are Delta. One of the common things that we get questions about, or we have misperceptions about, is that there are these internet rumors that we can't even test and we can't determine what the variant is, and you can't tell the difference between the different strains of COVID. That's not true. They can sequence these out. They do the genomic sequencing, and that's how they identify what strain or what variant it is. That's a labor-intensive process. So it is true that we don't test every sample, but they test a subset of every positive case, and then we can make predictions about proportions and percentages that are the different variants. And right now, it's pretty much all Delta. It's just outcompeted the other strains, and that's largely responsible for the surge that we were seeing. That in combination of the fact that we did away with all of our communities mitigation strategies. We were having people interact. We quit wearing masks in public back in the summer, and that's allowed it to take over. Probably with Delta, this surge was inevitable. We were probably always going to have a high rate of cases. What's unfortunate is, the high rate of hospitalizations and the mortality that we're going to be seeing from this was avoidable, and that would have been avoided if we'd had more people vaccinated.
Okay, thanks. Dr. DuFrayne, so we've got the Delta variant. What's the hospital seeing? Is it more contagious? Is it more virulent? And one thing I've noticed is it seems to be attacking younger people. If you recall, the first one, old folks like me were coming down with it, being hospitalized, but we're seeing younger folks now.
That is correct. So let's go back to your first question. Is it more contagious? Yes, it is. Is it more virulent? Yes. So we do know that your symptoms tend to be more severe, particularly in those who are not vaccinated. The incubation period is actually a little bit shorter. Before the Delta variant, it was about 5 to 7 days before people really started to develop symptoms. Now it's as short as 3 to 5 days. So it's more contagious, more virulent, and actually much more concerning. So, yep.
And we are seeing younger folks,
Yes.
or more. The percentage of young folks is larger this plateau or this go around than it was the first couple.
So referring back to the chart that you showed earlier, before, in the winter, December, January, everybody who was admitted, not everybody, but the vast majority of people admitted were 60 and above, 60 to in your 90s. And now we have 18-year-olds, 21-year-olds, 25-year-olds. If you really look at the numbers, and that's why we put that at the bottom of that chart, it's actually happening more in our younger generation, younger people who tend to have a lower vaccination rate. And they are not immune to this like they were before. So mortality rate has gone up, admission rate has gone up, and the intensive care rate has also gone up.
The first question that we've gotten from folks who are watching this: what kind of therapeutics are being given locally to people once they test positive? Dr. DuFrayne?
So right now we're using what's called the monoclonal antibody infusion. And that is Regeneron, which is 2 different medications that's in one infusion. And we have seen a very significant reduction in admission, reduction in symptoms in people who have received that therapy. So there are criteria for who we can give it to, just more for a supply reason right now. As the supply comes better, those criteria will lessen. But it's not uncommon if we give you that infusion today and we call you 36 hours later, people will frequently say, oh my goodness, I feel so much better. So right now, our push at the hospital is we want to give you, for people who qualify, we want to give you the Regeneron this week. So we're not admitting you next week.
So just quickly, the qualifications, is it time of infection, the stage
Yes.
where we're at?
Yes. So early on, we said we should give it to you up to if you have the symptoms for 10 days. We're now realizing that by day 3 to 4, we should really have that in you if it's going to have an effect. So the criteria are based on age, 65 or older, if you're immunocompromised. And then there are secondary qualifications which cover a lot of areas. Do you have hypertension? Do you have COPD? Do you have all these other risk factors? What's your BMI? How heavy are you? So there are a lot of factors that we can take into consideration. And then your symptoms. If you have really mild symptoms by day 4 or 5, we're less likely to say, oh, you need it. But there are some people now by day 3 or 4, they're pretty sick.
So the monoclonal antibodies, that's one. Is there anything else? Anything else that's being given?
So the things that have been proven to be effective are what we already discussed, monoclonal antibody, and then also using remdesivir. So you have to be admitted to the hospital in order to get remdesivir. It's a once a day infusion for 5 days. Again, we see a fairly good response to that. So those are the two that have, without a doubt, been shown to be effective. There are
And that is, I'm sorry, go ahead.
Oh, there are a lot of other medications and supplements that are being touted, and either it's clear cut that they're not effective, or that it's really kind of vague. It's hard to tell one way or the other if they're effective. And I'm going to say across the country, hospitals are not routinely using those.
And I was going to ask, I mean, I've heard it for ivermectin,
Yes.
animal, particularly horses, to get rid of parasites. That's not one of them that the hospital is suggesting.
That is correct. So again, the literature doesn't really support it. The studies don't support it that well. And even in some studies where you see a little bit of an effect, it is so blurred and you really can't make heads or tails of it. So now it's gotten to the point that I've seen that a judge has ordered 2 separate hospitals to actually give it to the patient, which to me is a little concerning that you have your legal system now doing medical treatment.
Well, you saw that. The question is, how true is it? Because there are a lot of things that you see on Facebook that
Right.
have no basis in fact. And the fact that somebody just goes out and states that this happened doesn't mean anything. So
Right.
Another question from someone asking about the hospital data. And I guess, I mean, you guys dealing in the medical field, it's like we know what we're talking about, but a lot of people on here don't. Would you explain intubated? And is there someone in the hospital right now under 20 years of age or at 20 years of age that's intubated? What does intubated mean?
So intubated means I am struggling with breathing. We measure that through something called a pulse oximeter, just a little device that goes on your finger, and it tells me what level your oxygen is at. So we know when your lungs are really affected by COVID, it really can impair your breathing capacity. And when you get to a certain level, we then put a breathing tube in, goes through your mouth or your nose and then directly into your lung. We hook you up to what's called a ventilator, which is a mechanical way of breathing. And those patients are then sedated so that they're not fighting the process. And that will breathe for you, giving your body time to repair itself. So that's what intubated means.
And ages, we've seen folks as young as 20 intubated.
Yes, correct. We've lost people as young as 20. And they went through the same process that our 75-year-olds were going through a year ago. So intubated, then we do something called proning, where we actually have to flip you over and you lay on your belly for 20 hours out of the day. And that just really helps to expand the lungs. So it doesn't matter what age you are, you're at risk for that.
Clay, lots been made about getting boosters. This might be for Dr. Frame, but I'm going to throw it to you. I hate to see you just sitting there not earning your pay. You know, a lot has been going on about boosters. As I had my first shot in January, second shot in the 1st of February. As the time lengthens from your first vaccine, I think there's some evidence that perhaps a booster would be beneficial to some folks. Are boosters being given here in Daviess County, I guess, and what's the criteria to receive?
So right now, the guidance from the ACIP, which is the Advisory Committee on Immunization Practices, is recommending a 3rd dose for anyone that's immunocompromised. So folks that have had an organ transplant, that are receiving treatment or have recently received treatment for cancer, for either blood cancers or tumors, and there's several other criteria that are listed in that guidance. They would be eligible for that 3rd dose if it's been at least 28 days since their 2nd dose. And I know that we've had several questions about it. We've referred those individuals to their primary care physician to see what they would refer in terms of, or prefer in terms of timing. We've heard some that want to push that out a little bit longer than the 28 days. But those individuals are eligible. They would just basically present to a vaccine provider, and there's a process for them to attest to that. And then we provide that 3rd dose. Now, it's been announced by the federal government that they intend to make 3rd doses available to the general population sometime in the end of September. I think September 20th was the target date. Those specific guidelines have not come out, but what's been discussed is that 3rd dose would be recommended 8 months following your 2nd shot. So if you received your 2nd one, Judge, in February, you would probably be looking, somewhere towards the end of October, November.
Yeah. The Dr. DuFrayne, on that 3rd dose, does it have to be the same as your first 2 shots? Or if you got the J&J, the 1 shot, does it have to be J&J, or can you mix and match now? Because I've seen some data that says, yeah, mix and match is fine.
Right. So right now, we're currently not recommending it. So if you got Moderna, you should probably get Moderna as your 3rd shot, or Pfizer. But you are correct. There is good data to support that. If you got Pfizer the first time and Moderna the 2nd time, it's also effective. The big question is going to be, what do we do with J&J? Because you had 1 shot. And now when you come back in, do we give you a 2nd shot? But we have real concerns about women between 20 and 50. Do we want to give them a 2nd shot? There is a risk there. Or do we switch you over to a Moderna or a Pfizer? And there's just no guidelines for that as of now.
It would seem to me that the J&J uses a benign virus, an adenovirus, to get the stuff into your body, where the others are mRNA. They use a little, and I hate to use the word nanoparticle, fat particle, to help it get into the cell. But it would seem to me that if that difference there would keep J&J folks from getting the mRNA from the Johnson or from the Pfizer and Moderna. Another question we've had, or this is more of a statement, it says, are more children catching the Delta variant because more elderly and adults are vaccinated? And partially that could be true, because it would add to the numbers, because they're more likely to catch it where the unvaccinated. But if nobody was vaccinated, I think it would be the same right down the line. So Clay, you can answer that one.
Yeah, so I mean, our older population tend to be the ones that are more vaccinated. So once you start dropping under the age of 40, those vaccination rates are really going down. So that's the vulnerable population right now. I mean, we've heard people use the term that it's a pandemic of the unvaccinated. And while we do have these breakthrough infections, overwhelmingly, most of your cases are unvaccinated individuals. And with the younger demographics being less vaccinated, it makes sense. And that's why we're seeing it.
Okay. Any update when the FDA will allow younger children to be vaccinated, Dr. DuFrayne? I mean, right now with Pfizer, as young as 12, I think they have trials going on with the younger kids. Have you heard anything?
So the most recent trial, and I believe it's for Pfizer, is ages 5 through 11, because 12 and above can be vaccinated now. We know that. Those trials are ongoing, and I'm going to say they're going to take longer than you typically. There's just a time of precaution to say, are the kids doing well with it? Are they responding to it? Does it really help? So I don't think you're going to see 5 to 11-year-olds being vaccinated. Probably the earliest would be late winter.
Okay. This seems always to come up, but the question is on the hospital statistics that you showed and hospitalizations, how do pre-existing conditions, including obesity or high BMI, factor in with hospitalizations? Go ahead.
So we're not really publishing that data, but we just know across the country and from all the other studies, and it really bears out here. So big risk factors, obesity, and if you walk through the intensive care unit, the vast majority of people are going to have an increased body mass. And then the other factors do come into play. Your hypertension, your COPD, diabetes. So yes, we just know across the board, if the more risk factors you have, the more serious the infection.
But let's go back. Isn't that the case with any viral infection? Isn't that the case with your body is fighting those other factors to begin with? And if you're exposed to something that's going to really make you sick, you're probably going to get sicker and for longer and increase the chances of you having a very bad outcome.
And I would say categorically, yes, that's true.
Okay.
Yep.
So here's an interesting, how do we get out of the red zone when people aren't following the rules? Well, my take on this is there aren't any rules, meaning there aren't any rules that are being enforced by anyone. There are recommendations. But the best way to get out of the red zone, get out there and get a vaccination if you're not vaccinated. What say you, Clay?
Yeah, I agree with that. I mean, I think I've said it before, but the vaccines are our exit strategy for this problem. I think, right now, we have a lot of folks that aren't listening to us. We have a lot of people that don't believe. And so I think right now, though, it's kind of important that we talk to those that do take this seriously. Dr. Stack the other day was meeting with the local health department directors. He's the commissioner for the state of Kentucky for public health. And he cited a book that he had recently read. It was called Crisis in the Red Zone. And it's by this guy named Richard Pearson, I believe. And he wrote a book, Preston, he wrote a book called Hot Zone that I read when I was in college. So that was back in the 90s. And I don't remember much about Hot Zone other than it was about Ebola outbreaks in the late 80s. But Crisis in the Red Zone was about the Ebola outbreaks that they had in 2014 and 2016. And what happened, a lot of the same dynamics, you had naysayers, you had the doubters, you had people calling that it unreal. And at some point, those that took it seriously had to protect themselves, and I think that's where we are right now. We are in the hot zone. And if you need to be vaccinated, but even if you are vaccinated, like right now is not the time to take the risk to go out into the big crowd. It's not the time to get into an indoor gathering. If you're in charge of an organization, you should be doing your meetings virtually. You should be wearing masks when you're around other people. And I think for those that are concerned, those who are concerned for their families, right now you just need to be cautious. You need to take care of yourself. And we have to wait to the transmission rates go down. And, I don't know how to convince those that are doubters. So for those that believe, take care of yourselves right now.
Dr. DuFrayne, how do we get out of the red zone?
So I was listening to Clay's answer, and I agree with what he was saying 100%. But it's also our observation for the doubters, for the people who think vaccines and masks don't work. So time and time again, over the last 6 months, as things started to relax and people are going back out in public, I can't tell you how many people we've admitted, clusters of families that have had 4th of July celebrations and barbecues and the whole family's not vaccinated, extended family members. And all of a sudden we're seeing 2, 3, and 4 of those people being admitted. And it just goes back to reinforcing that we still need to do what is best for our community, for our families, for our loved ones. And big family social gatherings, particularly indoors, in a number of people are unvaccinated, you are going to spread it and your family members are going to get it. So we have to follow the guidelines.
You know, that, and they are guidelines. They're not mandates.
They're not mandates.
And we, if you look at the statistical evidence coming from states who have issued mandates versus those who have not, you see some similar statistics. The virus is very contagious, and it's going to get to you if it can get to you. And while I'm at that, I've got a couple more questions that just came in, but I want to talk. Can you, Dr. DuFrayne, talk to the prevalence of RSV? Seems to me that there have been a tremendous number of cases occurring. I have a great niece who was at daycare and she came home. All of a sudden, a great nephew, all of a sudden, seems like it's spreading all throughout the community.
And it is. I mean, just if you look at our hospital admissions. So as of right now, today, we have 8 children in the hospital who have RSV. We had 24 for the month of August. This is not a summertime infection. Same thing as flu. We've had 4 or 5 flu cases already. And again, we don't start to hit that till November or December. So we wore a mask for pretty much all last year, and our number of RSV cases was really nowhere. And I can tell you, because we followed this, we had one flu admission last flu season. Normally, those admissions for us are in the hundreds. So it just is another reinforcement of the things that we were doing really apply to all viruses. Masks, social distancing, it really worked. There was concerns coming out in the spring that we'll probably see RSV and flu earlier. And that's exactly what's bearing out.
Okay. You know, viruses are extremely. So here, and the one thing I keep seeing and hearing from people is that's not a virus coming through there. And really what we're trying to stop are the droplets of spittle or the things that come out of your nose, those kinds of things which carry the virus. That's why this is effective in preventing me from blowing the virus onto you. So that's what a lot of people don't understand.
Judge, can I add something to that?
Yes, sir. Yes, sir.
And I agree with you. It's really about the droplets, but I'm also going to say there is a mental or a psychological component to wearing the mask, because when you're out in public and you have your mask on, it's just a reminder to not gather, to socially distance, to really be aware. And it's just as beneficial as it is preventing the droplets.
And I agree with that. So let's talk about the booster shots one more time. Is there a different formulation for specifically targeting, the Delta variant perhaps, or is it the same makeup as the original vaccine? And is the dosage different? Is it a larger dose or is it the same dose?
One, it's the same vaccine. Nothing has changed. It's the same dose. It's not targeted towards the first COVID or now that we're in Delta. Down the road, if they may be able to say, oh, for this variant, we need to use this dose or tweak the substance a little bit. But right now, we're not there. The vaccine may be a little less effective with Delta. We're not sure yet, but it's still highly effective.
We do that already with the flu vaccine, right? The
Yep, every
formulation
year.
is different every year
Every year.
based on the prediction of what
Yep.
variant of flu is
Yep.
going to affect us. As COVID cases have risen in recent months, you know, I'm going to ask the question, and I know the answer. Have we seen our vaccination rates change, Clay?
We have seen an uptick in people seeking vaccine. You know, we slowed down through the month of June and in July as well. But August we've seen an uptick. You know, just from our clinics that we are doing. You know, we do clinics with different community groups. Demand's way up. You know, 20 or 30 was a fairly good day in July, and we're usually around 100 for a half day clinic now. So we are seeing that. You know, we also are seeing policies that are being put in place. You know, a lot of employers are encouraging or requiring employees to get vaccinated or have to go through routine testing. So all of that has an impact, and vaccine rates are up, and we hope they continue to be up, and we get more and more folks vaccinated.
You know, Dr. DuFrayne, one of the things I keep seeing on Facebook is the concern about mRNA vaccines. Haven't been around for very long, just developed just like that. And I think I'm not wrong, and the mRNA technology has been in existence for 10 years, 15 years anyway. And of course, somebody said, well, the way that we used to produce vaccines, you kill the virus and you inject those particles in, or you use that adenovirus that's not as harmful to humans. You know, we do have a vaccine in the J&J that doesn't use mRNA protein or mRNA technology.
Correct. So interestingly, J&J is effective, but not as effective as the mRNAs. And the mRNA technology has been around since the 1980s. That's 80.
Yeah.
And the vaccines have really been in existence for at least 2 decades. And that's why we were able to actually come up with this so quickly. So if we use the older technology, we'd still be waiting for that vaccine. But now that we've really been working with this and preparing for this, that's why within 6 to 9 months, we were up and ready, up and running.
Unheard of, amazing.
Yes.
And I don't mean to scare anybody by saying unheard of. That means it wasn't tested. I don't know, Clay, in the United States now, at one time I saw the figure 167 million fully vaccinated. It's probably in the neighborhood of 200 million now, somewhere in that range. So don't tell me it's untested, because 200 million folks who have had it popped in their arms, as well as the billions of folks throughout the world who have had it popped in their arms. Now, but because of that, there are some people who talk about the vaccine adverse response reporting system, the VAERS system. And Dr. DuFrayne, I just want to bring that up a little bit, because my understanding is anybody can report. You don't have to be medical. Anybody can report, and it can be any reaction. As an example, I could go and get back today, walk out and have a heart attack, and somebody could report that I had a heart attack after I received a vaccine. So tell me a little bit about how perhaps people are misinterpreting what they see on the VAERS system.
So what you said is exactly right on the money, because it's a reporting system so that data can be gathered and then analyzed in much greater detail to say what is a real reaction to this and what is, just like you said, just an occurrence. So you could get the vaccine today and tomorrow develop a rash, and you go on the VAERS system and report your rash, and 2 days later your doctor diagnoses you with poison ivy, but that rash is still in there. I've heard it from some people that, oh, I got the vaccine and a month later I had a miscarriage. But it's not related to the vaccine, but that data is in there. So it is a publicly reporting system that we can just use to really start to analyze. It's really not there to put in a lot of credence to say everything that's reported is significant.
And I think the VAERS system, when they first showed some small numbers of blood clots as a result of J&J, that came from some reporting that occurred on the VAERS system. So I mean, it has a function, and it's a very good function, but it needs those reports need to be analyzed and the background check to see exactly what is going on there.
And you have to keep in mind, after it's reported, behind the scenes, there are massive computer data banks. There are epidemiologists and scientists who look at all that and then really come up with exactly what you said. Oh, look, we are starting to see blood clots in a particular age group. So let's delve into that more. So that's where it's really beneficial.
Right. Clay, so, and when you guys need to go, just tell me to shut it down. Is the health department still doing contact tracing?
We're trying. It's very difficult with the case levels like they are. So, back in June, when you talked about some of the rates that we were seeing, we were seeing a couple of cases a day in Daviess County. We would do a little bit more intensive investigation. We would talk to not only the positive case, but anyone they had contact with, we'd reach out and talk to them and provide that education. But when we're getting 230 cases a day, which is what we're seeing for the district, and we've had days where we've had 400, we're doing good just to call the people that tested positive. So right now, we are trying to have a very brief, quick conversation with those that tested positive, make sure they're okay, make sure that they're given a minimum amount of education, make sure that we let them know that, what they need to tell people they were in close contact with, how to quarantine, or if they're not vaccinated, or to watch for symptoms if they are. But no, the system is overwhelmed right now. And we're not reaching out to every contact. We are still trying to respond to high risk situations. If we find a child that's in school, we try to get that information to the school. Daycare, same thing. Jails, nursing homes, those are a little bit more intensive investigation at this point. But the general public, there's just not the resources to do a case by case investigation on every single case.
So, since we're not doing as much contact tracing and notifying, when should I get tested for COVID? If all of a sudden I get a stuffy nose and I'm starting to cough a little bit and my throat's a little bit sore, do I go get tested then, or do I need to have a fever? When do I need to consider getting tested?
So if you have any of those symptoms, you should go ahead and get tested. You should isolate from other people, get tested. If it's negative, then obviously you want to follow up with your doctor to try to figure out what's going on. But if it's positive, then you have COVID-19. You need to continue to isolate from individuals for at least 10 days or until you're well, 10 days minimum. And then you need to notify anyone that you had close contact with for while you were sick or the 2 days before. And those individuals, if they are unvaccinated, need to quarantine for 10 days. If they are vaccinated, they don't need to quarantine. They should wear a mask around other people. And if they develop symptoms, then they should immediately get tested and go through that same process.
Good. That's the advice I gave to someone I talked to this morning, but I got it from you. So that's pretty cool. Dr. DuFrayne, so the Delta variant, even though it's COVID, is it presenting any other symptoms that wouldn't have been there when the original COVID showed up? Are there different symptoms for it?
Not really. So, okay. and that's one of the issues.
It will just, right. It just will present maybe a little sooner than
a little sooner, and maybe it'll come on a little bit stronger.
Right. So, this kind of goes back, and I probably should have asked this question earlier. Why are we seeing breakthrough cases? Is the efficacy of the vaccines waning over time?
I don't know that we know that for sure. There is some data to suggest that vaccine effectiveness may wane. That would make sense. That wouldn't be a surprise. That's one of the reasons why you're seeing the discussions about doing third doses or booster doses. I think a lot of it has to do with just how virulent this strain is. And there's tons and tons and tons of exposures out in the community. The analogy that I heard someone use the other day was the vaccine's like a raincoat. It's going to keep you dry in a light or a moderate rain. It does a pretty good job of that. But if you stand out in a monsoon, or you spend an hour outside on Monday in Owensboro when we had that terrible rainfall, it doesn't matter what kind of raincoat you've got on, you're getting wet. And that's what's happening. We're getting these high doses of exposure to the virus, and therefore, it's a numbers game. The more people that are exposed, even if you have a small percentage of breakthrough infections, big numbers, a small percentage of a big number is still a pretty big number.
Mm-hmm. Yeah. Well, so one of the questions that come in, we just have a couple more, just time for a couple more. And I really appreciate you giving us, the folks of Daviess County and Owensboro, this time. But is 380 infections, is that a peak? Is that as high as we are going to go? And they say it doesn't seem like it could go much higher. Remembering that 380 is a 3-day total, I believe. And we were at a much higher rate than that. At one time, I remember somewhere around 105, maybe 110 cases per day back at the peak of the last go round. You looking? Is that what
Yeah, I'm looking at numbers. So, I mean, we have, as a district as a whole, we hit a new peak early this week. We were higher than we were back in January. Daviess County, you're right, maybe not quite as high as we were in January. I tend to look at all 7 counties, most of the time. But I don't know if we've peaked yet or not. The last day or so, the numbers have been down a little bit. I'm not 100% sure that the numbers are really down, or if we've got a problem with the electronic labs loading. We're looking into that. But it's how high will we go? I don't know. I hope it doesn't get any higher, but the answer to that is if folks start taking this seriously, if we get more people vaccinated, we will see those wear their mask. We will see the numbers come down. But right now it's not easy work right now.
In that vein, Dr. DuFrayne, how close are we coming to full capacity at Owensboro Health and in the hospitals surrounding us? And by the way, congratulations on the really great work that you did in transporting patients from, I think, Litchfield to Owensboro Health when they lost power.
Thank you.
So
that was a real team effort. I have to tell you, the whole organization kind of rose to that challenge, and it really went off really well. So thank you.
So the peak hospital capacity, are we there yet?
So I have to answer that in 2 ways. The first one is the number of beds. Overall bed wise, no, we still have more capacity. The second answer is really comes down to our staff, the number of team members, the number of nurses, and we're no different than across the country. There's a real shortage. And now team members are tired, nurses are tired. We've been doing this for 20 months. You can speak with people as you're walking through the hallways and realize, whew, you're really tired, and I get it. So that's more of our limiting factor now.
The last question, with respect to schools, how do we balance health and safety of our students with their intellectual needs to be in the classroom learning every day, Clay? And I want to give kudos to our local school systems, all 3. I think they made a wise choice, and they're taking that into consideration by staying open but requiring universal masking in schools. So how do we do that? Is there anything else we can do?
Well, I mean, there's a lot of different strategies, and we keep talking about a layered strategy approach to keeping schools open. But I think everyone's in agreement that the number one priority, I mean, obviously we want to keep them safe, but the number one priority is to do everything that we can to have in-person school 5 days a week. Universal masking is probably one of the most important of those strategies. The other one is vaccines. And obviously, those students that are under the age of 12 aren't eligible to be vaccinated. So mask are their primary strategy. And then beyond that, trying to surround them with vaccinated individuals. But there's other things that are happening. They're still trying to do distancing. We do contact tracing in schools. The schools do most of that themselves. We're available for consultation on that. We feed data to the schools. I mentioned earlier, when we find a case in a school employee or a school student, we notify the school system so that they can do contact tracing and protect folks. But that is the number one priority. We are seeing schools in Kentucky close. Fortunately, none of our local school districts have. And if we can continue to be vigilant, hopefully we won't see that here. But the key is continuing to mask, continuing to encourage vaccines. And for people that have kids in school, this is important to them to keep kids in school full time. They should be doing those things in your personal life as well. So be cautious, wear a mask when you're in public, and get people in your family that are around the children vaccinated if the children aren't eligible yet. If they're old enough, then by all means get the students vaccinated as well.
Judy and I and a group of folks went out to eat last night. We all went into the restaurant with a mask on, sat down, and passed around a bottle of hand sanitizer. And we passed it around when we left the restaurant. I mean, you do the things your mama told you, wash your hands every day and follow the guidelines. And, my mom and dad didn't mandate a lot of things, but I knew I should be doing them anyway. Before we go, Dr. DuFrayne, any parting words?
No, we're not out of this yet. I know people want to believe we're out of this. That's one reason we started really publishing the data. We are not out of this yet. And go back to an earlier question, could this get much worse? Actually, it could. There is no doubt that we could continue to see higher and higher numbers, which is a concern. We are not a stress system yet, but it wouldn't take much. So we want to really help take care of our community.
The Clay and last question coming in, and you might know it finally popped up, herd immunity. Are we close?
I have no idea.
Get there?
Yeah, I mean, I don't think so. But to hope for herd immunity, I think is just wishful thinking. The things that we need to do. I hate being the broken record. I keep using the broken record analogy, but I mean, if don't hold out on getting vaccinated because you think we're going to reach herd immunity. That we don't know if we will or not. I don't think it's likely. So get vaccinated, protect yourselves. Do the things right now that are available to you to do that. I know we had some questions about therapeutics, and Dr. DuFrayne talked about the monoclonal antibodies. I mean, that's great technology. That's great medicine. But wouldn't it be better to just not even have to use that? Because
Amen to that.
I mean, I don't know what those charge. A couple of $1,000s probably in cost for one of those treatments. The vaccines, are about $20 a pop. A mask is $1.50. Let's do the things that are available, that are easy, and we'll see better outcomes.
I'd rather protect myself from a sickness than have to recover from a sickness or an illness. I think that's what you were saying. Well, let me take this opportunity to thank both of you. Clay, please pass on our thanks to you, your staff, and particularly to you. You work tirelessly. It's important work that the Green River District Health Department does, and you cover the 7-county grad region. Big responsibility. And so thank you, Dr. DuFrayne. Thank you, and Owensboro Health for what you're doing. And I want to thank all the healthcare workers out there. You're exactly right. If we are stressed and tired, and we're just dealing with our little bitty world, and you guys are dealing with every case that ends up at that hospital, and healthcare workers really are concerned with their fellow man. I want to say thank you for that. Mm-hmm. We probably will come back again. I hope the next time we three gather around the cauldron to stir the brew, that perhaps we can talk about the decline in the number of cases and how things are starting to look up. But folks, I'll leave you with this. I used to say that the mask was the best tool in our toolbox, and it was for many months. Now the best tool is the vaccine, and the vaccine protects you. And remember, if you travel on the airlines and there's a reduction in cabin pressure and the oxygen mask pops out, the first person you take care of is you, and then you try to take care of other people. That vaccine is the best way to take care of you. So thanks everybody for being here. And next time we join, I hope that we have better news for everybody. Thanks, guys.
Thank you, Judge.
Yep.